So circulating tumor DNA is getting a lot of attention, especially given that detectable ctDNA has been shown to have increased risk of recurrence and decreased disease-free survival. So at our institution, we are doing a study looking at circulating tumor DNA at the time of diagnosis and looking at the trend of the ctDNA dynamics over the course of the treatment in the neoadjuvant setting as well as in the adjuvant setting, that is after surgery. So we did a study looking at about 34 patients who are receiving neoadjuvant therapy, and 27 out of the 34 patients had detectable ctDNA at the time of diagnosis. And in these 27 patients, they were mostly high-risk patients. They had mostly triple-negative breast cancer or HER2-positive breast cancer, stages 2 and 3. We looked at the breakdown of these patient populations, and higher stage predisposed them to ctDNA detection. Higher grade of the tumor, so grade 3 tumors had 100% ctDNA detection at the time of diagnosis. Node-positive disease also had a higher rate of ctDNA detection in this group of patients. Once you started neoadjuvant therapy, you could follow the ctDNA dynamics, and you can see that close to half of the patients would become negative by cycle 2, and more patients by cycle 3. And most patients would have undetectable ctDNA prior to surgery. But in this group of patients who have undetectable ctDNA, only half of them had pathologic complete response, and the other half still had residual disease. So patients who have residual disease will have escalation of treatment because they have residual disease, but their circulating tumor DNA was negative. So there's an interesting question comes about: what do we do in these patients who do not have a detectable ctDNA, but they still have residual disease? Do we need to escalate treatment, or do we just continue to monitor them with ctDNA in the adjuvant setting? And as part of our study, we also saw we had one patient who had a pathologic complete response at the time of surgery, but had rising ctDNA in the adjuvant setting. If we did not get the ctDNA information for these patients, for this patient, we would have continued the current standard of care, and she would have relapsed in a short time frame. But given the rising ctDNA at different time points, we changed the systemic therapy to another agent, and we followed the ctDNA, and it's currently undetectable. And hopefully that will continue to remain undetectable, which would mean a better prognosis for the patient.